In this lecture, we will discuss non-ionizing radiation, which is different from our previous lecture on ionizing radiation. So now that we have discussed ionizing radiation, we're going to talk a little bit about non-ionizing radiation. Non-ionizing radiation can be defined as a series of energy waves composed of oscillating electric and magnetic fields traveling at the speed of light. Ionizing radiation is on the higher frequency end of the spectrum. This is a little representation here of the different kinds of radiation and where they fall in terms of their wavelengths on the spectrum. And non-ionizing radiation is lower frequency. This kind of radiation includes ultraviolet, visible light, infrared, microwave, radio frequency, and extremely low frequency. We will also be discussing lasers, and we're going to discuss that separately. But lasers commonly operate in the UV, visible, and IR frequencies. So to reiterate, here's another figure that represents the entire electromagnetic spectrum, which is both ionizing radiation and non-ionizing radiation. The ionizing radiation we just learned about is in the range of about 10 to the negative 10th meters wavelength and shorter. Radiation with a longer wavelength is non-ionizing radiation, which starts at UV, then visible light, IR or infrared, microwaves, radio waves, and extremely low frequency radiation at the very end of the longest wavelength radiation. The biological effects and hazards of non-ionizing radiation can typically be categorized as thermal and photochemical injuries, cancer and other skin lesions, and then possibly some neurological or immunological effects, although that can be debated depending on what we're talking about. So I have a couple of photos here that represent some of the typical biological effects of non-ionizing radiation. On the left, you can see an individual who has a sunburn, which is of course caused by UV radiation. And on the right, this individual is suffering from something called arc eye, which is essentially a flash burn to the corneas, usually due to exposure to welding light without the proper protection. So this is somebody who maybe looked at, maybe as a welder who wasn't using proper shielding on their face, and they looked at the extremely bright welding light, which then caused a flash burn on their corneas. First, we're going to talk about UV radiation. So UV radiation is found in the range of 200 to 400 nanometers of wavelength. UV can also be categorized in three different ways: UVA, UVB, and UVC. UVA has the longest wavelength and penetrates the skin the deepest, which causes the most amount of DNA damage of the three different kinds of UV. UVB affects mostly the top skin layer, and this is what typically causes burns. And then UVC has the shortest wavelength and doesn't actually reach the Earth from the sun if we're talking about UV coming from the sun. So it's not a typical hazard unless you are out in space. So we often think of UV hazards in the context of the sun, but there are additional sources that may cause UV exposure, which include welding, like we just discussed with the eye burns, germicidal lamps. So if you think of, especially kind of in a post-COVID world, all of the UV sanitizing lamps that have become popular, as well as other kinds of lamps. There are various health effects due to UV exposure. So this can include skin erythema, photokeratitis, infectious disease, and also skin cancer. So skin erythema is caused by the sun, which is pictured here on the right, or this kind of condition caused by the sun is also referred to sometimes as a sun rash or a sun allergy, and can occur in some individuals who are particularly sensitive to UV light. So this is different than a sunburn. Typically these individuals, when they're out in the sun and exposed to UV light, they will get these kind of bumpy rashes on their skin that can be itchy. Photokeratitis is essentially the same thing as arc eye that we discussed earlier. And as the graphic on the left points out, this can also be caused by UV light being reflected off of a snowy environment. So in this case, it's referred to as snow blindness. So again, this is damaging the cornea of the eye due to intense exposure to UV light. Next, we will cover infrared or IR and visible light. The visible light range is between 400 and 700 nanometers, and the IR range is between 700 nanometers and 1 millimeter. I'm not really going to go into depth about the hazards of visible light, as there's still some question about the severity of any negative health effects of visible light. So instead, I'm going to be focusing mainly on infrared or IR radiation. IR radiation can be classified as near IR or far IR. And IR has a lot of different uses, some of which are labeled in this figure, including imaging, optogenetics, optical communications, and night vision. The most common health effects of IR and visible light are acute thermal injuries, chronic thermal injuries, and photochemical injuries. However, infrared is being used and researched for therapeutic purposes. So this figure here was pulled from a paper that hypothesizes about the mechanism of action of IR, in that they believe it enters the mitochondria, penetrates the mitochondria of skin cells, which then causes a whole host of positive downstream effects that promote skin healing. So this is being used as a therapy for wound healing and things like that. In addition to the positive biological effects of IR radiation, it's also being utilized as a therapy tool. So IR imaging is being used more and more often as a method of monitoring injuries as well as monitoring healing in a non-invasive manner. Particularly as sports medicine has started to utilize IR imaging to prevent injury, so it allows them to detect regions with risk of injury in its early stages so that they can then have that person who's at risk of further injury maybe do some different exercises or take some rest. They also use it to diagnose injury as well as track the progression of healing after an injury, which allows them to better speed up recovery time and figure out when the athlete can return to their sport. Before we get into the rest of the kinds of non-ionizing radiation, I'm going to briefly discuss lasers. So laser is an acronym that stands for light amplification by stimulated emission of radiation. And the primary wavelengths of lasers include UV, visible, and IR radiation, which is why we're talking about it here right after we discuss those other kinds of non-ionizing radiation. Lasers produce an artificially created narrow beam of light in which all of the light waves have very similar wavelengths. And because the light waves have very similar wavelengths, they travel together with their peaks lined up, or we call that traveling in phase. This makes laser beams very narrow and also very intense. Because the light is so intense and focused, lasers can be incredibly hazardous and can cause a lot of injury to the skin and eyes if exposed. And this here is just a little figure showing what the inside of a typical laser looks like. You can see it's fairly complex. And this is an artificially created beam of light. So next we're going to discuss microwave and radio frequency. Microwave and radio frequencies operate at the lower end of the electromagnetic spectrum. Sources of microwave and radio frequency tend to be radar, radio transmitters, microwave ovens, Wi-Fi, cell phones, satellites. You can see here in the figure on the right, they show a few other sources of radio frequency radiation. And on the left is a diagram of a microwave. So you can see how the microwave utilizes microwave radiation to cook our food. So microwaves have a magnetron tube inside of their casing, and this is the source of radiation. And then there's a waveguide, which then kind of filters the source of radiation out into the microwave compartment where the food is so that it can cook the food. And then at the lowest end of the electromagnetic spectrum is extremely low frequency electromagnetic fields. So electric and magnetic fields are separable. You can measure electric fields in volts per meter and magnetic fields in milligauss. Some common sources of extremely low frequency radiation are high voltage power lines, various consumer appliances, and industrial equipment. As you may be aware, there is a lot of controversy about whether these kinds of electromagnetic fields cause health hazards. This is something that researchers started assessing and studying really back in the 90s, mostly is when it became kind of a hot topic. And especially then with the use of cell phones, people were very concerned about phones and cell phones possibly causing brain cancer. So this became a very big topic back then, and it's kind of had a resurgence in the past, I don't know, 5 years or so, people very concerned about EMFs and that sort of thing. However, to date, research has not shown any correlation between electromagnetic fields and conditions such as cancer. So now we're going to discuss how to control for non-ionizing radiation hazards. Much like the other hazards we've discussed, the main areas where we can control for radiation hazards is either at the source, along the path of the radiation, or at the receiver of the radiation. And like we discussed with ionizing radiation, path control involves distancing or shielding, and receiver control involves the use of personal protective equipment. There are some inherent limitations when trying to control the non-ionizing radiation at the source. So for example, we can't perform source control to minimize UV radiation from the sun because we can't control the sun. However, there are some methods of source control when dealing with other sources of non-ionizing radiation. For example, you can set power limits for sources of non-ionizing radiation. The FCC actually has set a limit of 1.6 watts per kilogram for power output from any cell phone sold in the United States. So that is an example of setting a power limit. We can also use interlock switches, which are switches that can be installed on machines to ensure that the machine or source of non-ionizing radiation shuts down if the setting is unsafe. And then finally, it's possible in some situations to install internal shielding to block radiation from exiting the source. So now we'll discuss path control. Kind of the fundamentals of path control for non-ionizing radiation are similar to those used for ionizing radiation. Primarily, distance is very important for path control in these situations. The inverse square law also applies here for uniformly radiating sources, which means that the further you get from the source, the exposure from the source decreases exponentially. Another form of path control for non-ionizing radiation is isolation. This essentially relies on making individuals aware of the hazard and warning them to stay away from the source. So in the US, there are specified or defined work zones that are specifically for radio frequency energy that depend on the severity of the hazard. So for class 1, there are no signs needed to warn people about the hazard in that work zone. For class 2, they need to have notice signs. Class 3 has caution signs. Class 4 has warning signs, and class 5 has danger signs. And these on the right are some examples of some signs that may be used in work areas where there is radio frequency energy present. Additionally, many places require an institute require the institution of lockout or tagout protocols, which consist of locks and tags being applied to energy isolating devices on hazardous equipment in order to prevent accidental exposure. So essentially, if you are going to use a piece of machinery or something that gives off non-ionizing radiation in a hazardous way, you would need to make sure that that piece of equipment or whatever it is that you're using is locked, so that if you just happen to stumble upon it and you're not aware of what it is, you aren't going to be able to accidentally expose yourself to the hazard. The final aspect of path control is shielding. So much like with ionizing radiation control, we can use special materials to shield from non-ionizing radiation hazards. These include welding curtains, glass, metal reflectors, metal mesh, and metallic surfaces. It just depends on the kind of radiation that you're talking about and the kind of work that you're doing. So for this last bit, we'll talk about receiver control. And essentially, receiver control boils down to the use of personal protective equipment, or PPE. So special eye protection is particularly useful in many of these situations and can include, for example, special glasses that have a reflecting or absorbing filter within them, welding shields, or even just regular sunglasses obviously can shield you from UV dangers. You can also protect the receiver using various kinds of shielding. So the shielding can be chemical, such as using sunscreen to protect from UV radiation, or you can use special clothing like this woman who is very shielded from UV radiation. For protection from radio frequency, you can use a special kind of metallic fabric, which is pictured here on the left. And then the final aspect of non-ionizing radiation control we will discuss is control of laser hazards. I have this separate because lasers can be particularly hazardous, so we need to take special consideration when thinking of how to control laser hazards. One method of laser control is the use of protective housing and interlocks. So by putting up a physical barrier that contains the beam and the laser radiation, you can ensure that the maximum permissible exposure is not exceeded on the outside surface. And it's, again, I mentioned interlocks earlier, lockout, tagout devices. It's important to use interlocks on these sorts of laser housings. If you are operating a laser without protective housing, you need to ensure that A, the access to the area is restricted so that there aren't people just randomly coming in when you are operating a laser. B, that barriers are up wherever possible. So this includes some sort of shielding when possible. C, that only individuals who are trained and allowed to be there in that area are actually there, and that the individuals who are there are wearing sufficient and proper PPE.